In this video, we will go through the different anatomical characteristics of the left lung. And a mnemonic that I want to introduce here to help you distinguish the locations of the pulmonary vessels, whether we're talking about the right lung or the left lung, is this term RALS, which means right anterior and left superior. We'll come back to that mnemonic in a minute, but I just want to introduce that now. So let's isolate and look at just the left lung by itself. So from this view, we're looking at the medial surface of the lung. We can see if I turn it over here, I only see lung tissue from the lateral side, but from the medial side, I can see all the content coming in or exiting the lung. So let's start with some definitions. The opening that provides passage for the blood vessels and the bronchial tree to come in is called the hilum of the lung. So again, this is the door frame that allows the content to come in or exit. That's the hilum. The actual content coming in or leaving, by that I mean the bronchial tree, pulmonary vessels, all of that content is considered the root of the lung. Okay, so now that we have those terms out of the way, let's look first at the different lobes of the lung. So if we look from the outside here, we can see we have a superior lobe and an inferior lobe. The left lung only has two lobes, meaning it only has a single fissure dividing those two lobes, and since it's diagonal, that is called the oblique fissure. Now, if you look closely, you can see this somewhat opaque layering situated over top of the lung. This is representing the visceral layer of pleura on the lung itself. So on the lung you have the visceral pleura. Imagine if the lung was back in the thorax, lining the ribs and the diaphragm below, as well as other content, would be the parietal pleura. So now let's turn back and focus on the medial surface of the left lung and come back to our term RALS, so right anterior, left superior. Well, since this is the left lung, we're going to focus on the left superior part, but no matter which lung we're talking about, the anatomical directional term, so anterior and superior, is always in reference to the bronchial tree, or the main bronchus. So left superior refers to the left superior portion on the lung, is referring to the left pulmonary artery. So the pulmonary artery on the left lung will be located superior or above the main or primary bronchus as it's coming into the left lung. That means that these other vessels, which are red in color, represent the pulmonary veins. We can see there's the superior one, and there's also an inferior one. So to quickly review, the term RALS is a quick and easy mnemonic to help remember the location of the pulmonary arteries in relation to the bronchial tree. So on the left lung, the pulmonary artery is superior to the main bronchus, as we can see again here. I'd like to finish this lesson by describing why the pulmonary artery is blue and the pulmonary veins are red. Remember, the pulmonary arteries, even though they are arteries, are carrying deoxygenated blood from the right side of the heart into the lungs for gas exchange. And then the pulmonary veins are red because they are bringing highly oxygenated blood from the lungs back to the left side of the heart. In this video, we will go through the anatomical characteristics of the right lung. In the left lung video, I introduced a mnemonic called RALS. We looked at what the LS stood for, which was left superior, and that's in reference to the left lung. Here, we're going to look at what the RA, which is right anterior, refers to. So let's isolate the right lung to look at its different characteristics. So I'm going to turn the lung first to look at it from its lateral side. and reposition it here. The left lung had 2 lobes, while the right lung has 3 lobes. We can see up here is the superior lobe, here's the middle lobe, and here's the inferior lobe. Because it has 3 lobes, it now has 2 fissures compared to the left lung, which only had 1 fissure. So we have a horizontal fissure and an oblique fissure. Like the left lung, the right lung also has this opaque layer on top of it, which is representing the visceral layer of pleura that is situated on top of both lungs. So now let me turn the lung so we can look at its medial surface. And just like the left lung, there is a hilum of the lung, which is this general door frame that allows the pulmonary vessels and the bronchi to come in to the actual lung. And now we can look back and reference the mnemonic I mentioned at the beginning of this lesson. Right anterior. So this is referring to, on the right lung, the pulmonary artery, which we can see here, is located anterior to the right main bronchus, which we can see here. The left superior, referred to on the left lung, tells you that the pulmonary artery on the left side is actually superior to the bronchus. So this is a great way, when you're looking at the medial surface of the lungs, to distinguish the left lung from the right lung, just based on the placement of the pulmonary arteries. And just like on the left lung, the right lung has superior and inferior pulmonary veins.